The UNICEF UK Baby Friendly Initiative recommends instructing all mothers on the technique of hand expression. This valuable skill proves beneficial in various scenarios. Expressing small amounts of colostrum to entice a drowsy baby during the initial stages of breastfeeding. Dealing with engorged breasts that make it challenging for babies to latch. Assisting in clearing a blocked duct. If separation from your baby occurs, such as when your baby is unwell. If separation is due to your baby being in the neonatal unit. When hand expressing, start by engaging in activities that promote relaxation. Whether it's cuddling your little one, practicing skin-to-skin contact, or incorporating a massage, choose whatever helps you unwind. Techniques like kneading or stroking around the breast can be used, adjusting to what feels right and comfortable for you. For premature babies, massage becomes crucial to ensure a proper milk letdown. However, if expressing only to soften the breast, a small amount of massage may be sufficient. After spending some time on this, form a C shape with your hand, using your thumb and finger, and gently move back from the nipple about 2-3 centimeters. Hold for a couple of seconds, release, and then compress, hold, and release. While expressing colostrum in the early days may take time, persistent efforts in one area will yield small beads, and as the milk comes in, it will flow more easily. Adjust your position as needed, always focusing on one area until it subsides before rotating to the next. Maintain precision by keeping your fingers in the right place during compression. Avoid sliding as it is less effective and can potentially cause skin trauma. If unsure, consult your midwife or health visitor for guidance on hand expression techniques. If expressing for a baby in the neonatal unit, try to do so in close proximity or keep a photo or a piece of the baby's clothing nearby. This emotional connection can enhance the production of milk-making hormones.